As a practicing physician, I see patients on a daily basis, and the most important tool I take with me into each patient encounter is my tablet computer with the electronic health record. My colleague has spearheaded the effort to make this experience meaningful, efficient, and much more complete than we've had in the past.
He has been a steady source of information, encouragement. He has a real can-do attitude. He knows how to help folks in the trenches because he's been in the trenches and he understands.
He has the most extensive organizational structure and org chart that I've ever seen. And that's because people want to work with him to help reach a lot of the goals that are pretty far out there that we are trying to accomplish.
He works with folks at all levels of the organization. He works with staff in the offices. He works with physicians one-on-one and in groups. He works with the other parts of the leadership team, and there's not an interaction I can think of where he hasn't added a perspective or a value that was something maybe we hadn't thought of. He's got a quiet demeanor, but speaks up when he's got something to share, and so it's really a perfect blend.
I have worked with my colleague both in a medical setting and an administrative setting, and he's very even-tempered, always has a vision of where we're trying to go, and then the leadership skills to get us there. And that's a unique combination that you don't see very often.
We run up against obstacles a lot, and when something just isn't right, I can always tell where it's going to go because he'll just say, "Nonsense." And he's off and running. And if you look back in history, you'll see that those things that are nonsense are no longer in existence, and we found a way to move past it. I think that people appreciate that, and it helps us to move closer to that goal.
He's taken it upon himself over the years to learn a lot on his own time and brought that value back to our organization. And he is just a steady force of calm and positive reinforcement for the hard work that the physicians and Adventist Health Partners do.
They say that getting physicians to change behavior, especially in groups, is kind of like herding cats. And those of you who have worked with physicians know very well what I'm talking about. My colleague has been herding cats quite successfully for several years now, and we owe him a great debt of gratitude for what he's done for us.
I am so pleased to be announcing that Dr. Chet Robson has been chosen as the Distinguished Leader for Adventist Health Partners. We could not do all that we do to provide great patient care and quality without you, Dr. Robson.